All right, welcome to the Explainer. Today we are opening the case file on a cellular crime that happens with, well, terrifying speed, acute leukemia. We're going to follow the clues, piece by piece, to understand how it starts, the damage it causes, and how modern medicine is fighting back.
So here's our game plan. We'll start at the crime scene, deep inside our bones. Then we'll identify the key suspects that can trigger the disease. After that, we'll profile the main culprits, assess the widespread damage they cause, and finally, we'll look at the high-tech counterattack from our medical detectives.
Okay, so to really get a grip on this disease, we first have to take a trip to the body's busiest factory, the bone marrow. This is where all of our blood gets made, and you guessed it, it's ground zero for leukemia.
Normally, your bone marrow is just this marvel of efficiency. You've got stem cells that mature into a perfect, balanced mix of red cells carrying oxygen, white cells fighting infection, and platelets to stop bleeding. But in acute leukemia, one single production line goes completely haywire. It gets stuck, and it just starts churning out endless, useless clones that completely take over the whole operation.
So these defective cells, they're the culprits at the very heart of this investigation. They're called blast cells. You can think of them like factory trainees who never ever learn their job, but they just multiply uncontrollably, creating total chaos and shoving all the skilled, essential workers out of the way.
And here is a really crucial piece of evidence. The number 20%. That's the tipping point. The minute these useless blast cells make up more than 20% of all the cells in the bone marrow, doctors can officially make the call. It's acute leukemia. It is the definitive line in the sand.
So the big question is, right, what causes this factory to malfunction in the first place? Well, investigators have a lineup of several key suspects that can corrupt the cellular machinery.
You know, there's no single bad guy here. Sometimes it's just an unlucky genetic hand you're dealt. People with conditions like Down syndrome, for example, have a higher risk. Other times, it's a very specific genetic accident, like the infamous Philadelphia chromosome. That's where parts of two chromosomes literally snap off and swap places, creating a new monster gene that just screams, grow, grow, grow. But environmental factors are also major suspects, everything from high-dose radiation and chemical exposure to even certain viruses.
All right, so the investigators have grouped these cellular crimes into two main categories, and it all just depends on which one of the body's blood cell production lines got hijacked.
So you've got two main families here: acute lymphoblastic leukemia, or ALL, and acute myeloid leukemia, AML. ALL hits the lymphoid cell line. That's the one that makes our immune system specialist cells. And tragically, it's the one you hear about more often in children. AML, on the other hand, affects the myeloid line, which makes pretty much all our other blood cells, and it tends to be a disease that shows up in older adults.
Now check this out. When pathologists, the forensic specialists in this story, look at the blast cells under a microscope, they sometimes find these incredible clues. These little needle-like things are called Auer rods, and they are a dead giveaway. If you see them, bam, you know you're dealing with AML. It's the absolute smoking gun for the diagnosis.
And within that big AML family, there's one subtype that stands out as particularly nasty: M3, also called APL. When doctors identify this one, all the alarm bells go off. It means this is a true emergency that needs immediate, highly specialized attention.
And here's exactly why M3 is so feared. These specific leukemia cells can trigger a complete and catastrophic breakdown of the body's clotting system. It's a crisis called DIC, and it causes massive, simultaneous bleeding and clotting all throughout the body. A true medical nightmare.
So this hostile takeover of the bone marrow, it doesn't stay local. Not at all. It spills out and leads to a full-blown, system-wide crisis across the entire body.
Often, the very first signs are these things that affect your whole body. It's a classic trio of red flags known as B symptoms: a fever that you just can't explain, night sweats that completely drench you, and losing a significant amount of weight without even trying.
But the real damage, the most immediate danger, comes from what those blast cells crowd out. You see, the problem isn't just the presence of millions of cancer cells, it's the absence of the normal, functional cells that we absolutely need to survive.
And this leads to a just devastating chain reaction. Without enough red blood cells, you get severe anemia, which causes this crushing fatigue. Without platelets, you can't form clots, so you get easy bruising and really dangerous bleeding. And without working white cells, your immune system just collapses, leaving you defenseless against any little infection that comes along.
So as you can imagine, this catastrophic failure of the blood factory can spiral out of control really, really fast. It can escalate into several immediate life-or-death emergencies that doctors have to be constantly watching for.
Doctors are on high alert for 3 major crises. The first is leukostasis. That's where the blood literally becomes thick like sludge because of all the blasts, and it starts clogging up tiny vessels in the lungs and brain. Then there's tumor lysis syndrome, where a mass die-off of cancer cells floods the body with toxins, shutting down the kidneys. And of course, there's DIC, that bleeding and clotting catastrophe we mentioned with the M3 subtype.
But, faced with this cellular insurgency, medicine does not surrender. It deploys this incredibly sophisticated, multi-stage strategy to identify the enemy, clear them out, and restore order to the body.
The main weapon is chemotherapy, and is delivered like a full-on military campaign in 3 phases. First up is induction. That's the heavy blitz designed to wipe out most of the cancer cells and get to remission. Then comes consolidation, which is like sending in special forces to hunt down and eliminate any hidden stragglers. And finally, there's maintenance therapy, which uses lower doses over a long time to make sure the enemy can never, ever regroup.
And remember that super dangerous M3 subtype we talked about? Well, here is where the science gets just unbelievably cool. Scientists developed this brilliant countermeasure, a smart drug called ATRA. It doesn't just kill the cancer cells, it cleverly forces them to do what they were supposed to do all along: grow up, mature, and then die off naturally. It completely revolutionized the treatment for that subtype.
And for the absolute toughest cases, we're talking very high-risk disease or a cancer that comes back after chemo, doctors bring in the ultimate weapon, a stem cell transplant. This procedure basically wipes out the patient's entire faulty bone marrow and replaces it with a healthy system from a donor. It is, quite literally, a complete factory reboot.
So where does this fight go from here? We've become these incredible biological detectors, right? We can identify and fight this disease on a molecular level. And that leaves us with a final and pretty hopeful question to think about. As our ability to decode our own genetic code gets more and more powerful, will we one day be able to move from solving the crime to preventing it from ever happening in the first place?